Hello everyone, my name is Somer Ranjandas and in this video I am going to be discussing on the topic implementation of cloud computing in the German healthcare system. So this paper aims to provide and explore the integration of cloud computing into the German healthcare system, particularly focusing on the compliance with European data protection laws such as GDPR and other local laws, and while focusing on that it aims to potentially benefit from digitization in healthcare. The authors' backgrounds are multidisciplinary with focuses on healthcare, information technology, and data privacy regulations, which is essential for addressing the challenges and opportunities in implementing cloud solutions within the healthcare sector. So moving on to the introduction, this presentation particularly focuses on four key topics: the importance of digitization in healthcare, the German healthcare systems lag in electronic medical records adoption model EMRAM, potential of cloud computing to improve patient healthcare, and then the fourth, that the challenges of handling sensitive data in the medical sector. So next we have cloud computing in healthcare. Cloud computing refers to the delivery of on-demand cloud computing services such as storage, processing power, and applications over the internet. This model allows organizations to access the resources without needing to invest heavily in physical infrastructure, making it flexible and a scalable solutions. Cloud services are typically categorized into three models. There is Infrastructure as a Service or IaaS, which provides basic computing resources. Platform as a Service PaaS, and which offers platforms for developing and managing applications, and then Software as a Service, which is predominantly used as AaaS, which delivers fully functional software over the internet. In healthcare, cloud computing plays a major role in various areas such as telemedicine, where it enables remote consultations and patient monitoring. It also supports medical image analysis, aiding in diagnostics and treatment planning, and powers AI applications that can predict patient care outcomes or assist in decision making. The key benefits of cloud computing in healthcare include its scalability, allowing institutions to manage growing amounts of data, cost efficiency as it eliminates the need for expensive IT infrastructure, and enhanced collaborations, enabling seamless data sharing thereby across all hospitals, research centers, and thereby improving patient healthcare. Let's move on to the legal challenges in cloud computing in healthcare. The General Data Protection Regulation (GDPR) is a key framework governing the processing of personal data within the European Union. It sets strict standards on how healthcare organizations must handle sensitive data information, focusing on data protection, consent, and security. Under GDPR, hospitals and healthcare providers must ensure that patient data is processed lawfully, transparently, and securely. Patients must give explicit consent for this data to be used, and healthcare institutions must implement robust measures to protect this data from breaches or unauthorized access. The stringent rules present legal challenges and constraints on the adoption of cloud computing in healthcare, as hospitals must ensure that cloud providers comply with the GDPR norms. Additionally, German regulations such as the Federal Data Protection Act (BDSG) and State Hospital Law (LKHG) adds further layers of complexity, placing additional restrictions on how patient data can be processed and stored. For instance, BDSG reinforces the need for anonymization or pseudonymization of data, while LKHG puts strict controls on data access in public and state-owned hospitals. These laws are essential for protecting patient privacy. However, they create challenges in implementing cloud-based solutions in the German healthcare system. Moving on to GDPR compliance in cloud computing. Under Article 28 of GDPR, healthcare organizations are allowed to use external service providers such as cloud computing vendors for data processing. However, strict conditions must be met, including ensuring that the data provider operates under the hospital's instructions and maintains high standards of data protection. Hospitals remain fully responsible for the security and lawful processing of the data even when it's handled by an external provider. This means that healthcare institutions must carefully choose their cloud providers that comply with GDPR norms and data security requirements. To handle sensitive information, hospitals must implement robust safety mechanisms. One such method is the use of broad consent, which allows patients to agree to their data being used for various clinical reasons and research purposes without needing to give separate consent for each study. Additionally, GDPR compliance involves separating personal health information (PHI) from general medical data to minimize privacy risks. PHI is kept secure and only accessible to authorized personnel, while medical data can be used more freely for analysis and for research, ensuring that privacy is maintained. And while privacy is maintained, research also continues to go on. So now let's move on to AIQNet overview. So AIQNet means Advanced Cloud Integration in Healthcare. AIQNet is a consortium designed to drive the integration of cloud computing in the German healthcare system. It brings together key players in the medical and technology fields, including founders like Realtek GmbH and various healthcare institutions. Since 2020, AIQNet has been funded by the German government and is a part of a broader initiative to modernize the healthcare infrastructure. The consortium's primary goal is to develop interoperable AI-powered medical systems that can seamlessly connect hospitals, clinics, and research institutions. By focusing on cloud-based solutions, AIQNet aims to create a digital ecosystem where medical data can be securely shared and analyzed in real time. This will enable more accurate diagnosis, personalized treatment plans, and improved patient outcomes, which ensures compliance with the data protection requirements within GDPR. So now let's see the benefits of cloud implementation in healthcare. Cloud computing significantly enhances data sharing and accessibility within the healthcare system, enabling seamless access to patient data across hospitals, clinics, and research institutes. This leads to a more coordinated care and reduces delays in diagnosis and treatment. Moreover, the cloud supports AI-driven precision medicine, allowing for more personalized treatment planning. By analyzing large data sets, AI can help in predicting patient outcomes and suggest optimized treatment plans based on individual patient profiles. Cloud infrastructure also fosters enhanced implementation and collaboration between hospitals and research institutions, making it easier to conduct multi-center studies and share data for research purposes. This essentially benefits and is beneficial in areas like clinical trials and medical device equipment. Additionally, cloud computing helps streamline regulatory compliance processes such as those required by the Medical Device Regulation (MDR). The cloud's ability to securely store and manage data facilities uh, while monitoring and reporting processes need for regulatory adherence, reducing administrative burdens for healthcare providers. So, what are the challenges in the healthcare sector vis-a-vis cloud computing sector? One of the primary challenges is adopting cloud computing in healthcare is balancing data privacy with innovation. While cloud computing companies offer tremendous potential for enhancing patient care and operational efficiency, ensuring compliance with data protection laws such as GDPR remains a significant concern. Protecting sensitive patient information while enabling data-driven information requires a delicate balance. The legal landscape surrounding cloud adoption in healthcare is complex. In addition to GDPR, hospitals must also adhere to various German federal acts and state laws, such as the Federal Data Protection Act (BDSG) and state-specific hospital laws, such as LKHG, which impose further restrictions on data handling and cloud integration. These legal hurdles add to the complexity of adoption. Another challenge is the transition from legacy systems to cloud-based infrastructure. Many hospitals still rely on modern cloud solutions. Achieving interoperability between legacy systems and new cloud systems while maintaining operational continuity is a significant challenge in the healthcare system. Lastly, implementing cloud solution requires careful project management within the hospitals. Uh, this is to ensure technical, legal, and organizational issues, ensuring that patient care is not disrupted and that all stakeholders are aligned with their understanding of the new system's benefits and risks. We have now come to the end of the video. I would like to thank you for watching the video.